All right, Facebook. I did this on Instagram, but I don't know if I saved it right. Shows how much I don't do live videos. I really have to step my game up on that. I can do a recorded video and post it later, but I wanted to do live for a reason. One, many of you should be at home, and many of you are probably on social media anyway. So the reason I didn't do a lot of live videos is because I didn't really have a lot of time. But I got a little bit of time. I'll be wrapping up my day here. Yes, I am still going back and forth to some type of job. So when you're in healthcare, you don't really get a day off. And for those of you all who do not know me, I'm Dr. Shanté. My background in medicine, which has been a little over 15 years, maybe even close to 17 years now. I'm a doctor of pharmacy, PharmD, and I'm also a doctor of naturopathy or naturopathic medicine. So we're naturopaths with a P for pain, and that's just a quick background. I have plenty of things that talks about my backgrounds for everybody to learn more about it, and I may even do more videos about it. But I am broadcasting from my temp office here at the college. We're actually wrapping up the winter quarter, figuring out amongst this pandemic how best to ethically administer our finals, seeing that we have enacted social distancing and people aren't coming in as much, and most of our instruction is transitioning quickly to online. It was my intentions to launch that for fall 2020, but given the circumstances, we probably need to start right away. And so that's going to be a work in progress. So I'm here, and so is the staff. We're taking all of the precautions to make sure that we're reducing any type of spread of exposure. But again, after practicing in pharmacy for over 15 years, I am used to being around health pandemics, being a part of the medical community that is either administering some type of immunization or vaccination. As pharmacists, we had to be there. If something was getting ready to come, we were prepped. I went to UIC. They really prepped us for bioterrorism. So if I don't seem panicked or a part of the hysteria that we're seeing, because I don't want my reaction or what you guys may be seeing in my position or my sentiment to be viewed as if it's not a big deal. Okay, it's just I'm used to it and I've been prepared for it. So that's the standpoint that I'm coming from, where I'm more relaxed about it. Okay, they trained us for this. Okay, this is what we have to do. And I've been exposed to a lot of things, again, dispensing the medications that most people will take. So let's have a little perspective here, right? This type of thing, and by thing I mean health pandemic, has happened before. I can think of 8 other health pandemics in the 2000s alone. This isn't to say that they didn't happen well before 2000, but because we're in an age of the internet and social media, and we're connected globally by the internet, that is why the spread of this information is getting amongst people very quickly. But if anything that I'd like to accomplish from the video as I speak on COVID-19, aka the coronavirus, is just to help spread a little bit of inspiration to people. We're not in the apocalypse, okay? It may feel that way because we are taking these extensive measures to quarantine people, the social distancing to help reduce the spread of the infection. And there are reasons why we're doing that as well. But if I could just go back, give a little bit of history that we've seen these pandemics again, and I've lived through it. Wow. We've seen it with SARS. Okay, so SARS back in 2004. 2008 we had avian. 2010 we had the swine flu. 2012 we had MERS. 2014 we had the Ebola. Sorry, I'm plugging up my charger. I realized phone needs to be charged. Okay, hold on here. Okay. All right, where was I? 2014 we had Ebola. 2016 we had Zika. 2018 Ebola again, and now we're in 2020 with the coronavirus. COVID-19 virus. All right, so I just named about 8 different health pandemics, and they were spread at least 2 years apart. Some of you may remember a little bit, maybe not, but the reason, probably in the early 2000s, because social media wasn't a big thing, even though it existed. Many people hadn't transitioned to it yet. So these things were going on. We just didn't have the access to it the way that we do now. And then thinking about from 2008 to 2016, now that was the years of Obama. So even though those things were still happening, there was a control as far as keeping the hysteria down, keeping people informed, but also keeping them calm. And so that has a lot to do with leadership right now. So we're looking at this mass hysteria over something that's kind of normal. It's become normal. And again, I'm not trying to diminish the importance of what's happening out here. I just want to provide a little perspective, a little history, and above all, a little inspiration. We will get through this. This too will pass. Again, from 2004, starting with SARS, all the way, almost 2 years apart, all the way down to 2020 with Corona, we've seen this type of thing again before. One of the things that I want to mention about SARS is that it had a higher contagion factor than actually Corona. So if we want to kind of keep that in mind, while people are out and about and you see them sneezing or coughing, we don't want to immediately quarantine those people because some people have allergies, okay? So let's just keep those type of things in perspective. One of the things that I want to talk about is when it comes to the other viruses that are here. I'm here to shed a little bit more light on the other existing viruses that are a part of the atmosphere, a part of our world. Let's not forget about influenza. Okay, let's not forget about pneumonia. Let's not forget about the common cold virus, which is called the rhinovirus. So we have these family of viruses that have been existing for a very long time, and we've lived amongst it. Okay, I know that back when I was heavily in dispensing medication, whenever a person got sick, we noticed that the MD wrote the prescription for an antibiotic. I remember the day when Z-Pak was just heavy. You just kept seeing that. Now, if they did a test culture where they actually tested positive for a pathogen that, would be susceptible to azithromycin, and that if they did, okay, that's one thing. But to have a common cold and be prescribed an antibiotic, now, we would always look at, by we, I mean pharmacists, why would they give them an antibiotic? This is viral. So while we're talking about viral infections, they're just a part of our world. That's just how it is. Yes, we do have things that can kill bacteria because that's a different pathogen, okay? It has a different genetic makeup. And if we take this all the way back to biology, if you want to know a fundamental difference between the bacteria and the virus, that is the cellular makeup, okay? Bacteria is a, I just had it and then I lost it. It'll come back to me. Viruses are eukaryotic cells, okay? And bacteria are prokaryotic cells. That's what I was trying to say before, right? So that's just going way back to biology, microbiology, but that is the fundamental difference between them. And with the viruses, because of their genetic makeup being very similar to us, i.e. mammals, reptiles, any other species that you could think of that is under the category of a eukaryotic cell, virus falls into that category. And although we could create something that can kill the virus, we don't want to do that. We don't want to kill ourselves. That's the point that I'm getting at. So that is the reason why we don't have anything that would just eradicate a virus. Okay, and that's why they live amongst us. Okay, so we want to remember there's still influenza out there. There's still pneumonia out there. There's still, and I want to shed light to the other viruses and the other things and the other ailments that people are still suffering from, because we have this narrow focus on corona, and it's not just about corona. I'm not trying to diminish it, but at the same time, I'm trying to include everything else that we need to be paying attention to and that we should be mindful of. And so, who's at risk? All right, if you're pretty much young and healthy, you're at risk at contracting it, but who should we really be focused on? Okay, we definitely want to focus on a patient population that has a weakened and or compromised immune system. Okay, that will be people suffering from cancer, suffering from something like HIV/AIDS. Their immune system is already compromised. It's working to save them, to keep them alive for what they're battling. Those are the people where these opportunistic infections like pneumonia and influenza can be lethal to them. It can be deadly to them because their immune system is already compromised. It's not strong enough for them to beat what they're already fighting, plus the coronavirus, right? So now, and I want to wave at everybody, but I don't want to lose my train of thought, and I don't want to make it too long. But again, I just want to shed a little bit of light on the other viruses and the other things. The next patient populations that we want to be concerned for that are at risk: people with cardiovascular disease and diabetes. Certainly people with respiratory conditions already. Who are those people? People who has COPD, emphysema, asthma even, right? Those are people who already have respiratory conditions. And the elderly can fall in any of those categories, and they often have comorbidities as well, right? So they could have a combination of respiratory issues, cardiovascular issues, diabetes, decreased immune system function. It can be any of us. So those are the people who are at high risk during this pandemic right now. Of course, the younger, healthier people, and I'm just generally speaking healthy, because we can all do a little better in boosting our immunity. We can probably do better, and not saying that we're not going to experience the symptoms. We will, but those are the populations that we don't want to restrict the access to the care that they're going to. So if you think you have these things and you're rushing off to the hospitals and the medical centers, there's only so many staff allocated, for healthcare in general in this country, right? And if we're handling the hypochondriacs and the people who you'll be okay, you're taking our attention away from those who really need it. And so hopefully this could be a resource to the people that really need it and those that just want to be generally healthy. So you're not wrong from wanting to do better things for yourselves, but there are ways that you can certainly protect yourself, and that's boosting your own immune system. That should be of highest priority for everyone right now. Boost your own immune system, and there are ways that you can do it. I always recommend a multivitamin, right? We got a lot of controversy about that, and I mean that from the standpoint that some people believe in vitamins, some people don't. But medically speaking, scientifically speaking, micronutrients are essential in the reactions and things that take place in the body just for normal function. You need it, right? And we're not going to just break this up where you're just going to take this for this, take this for this. No, take the entire thing, a multivitamin. Vitamins work interdependently of one another. That's just the way it is. You guys want to go into detail on that? Sign up for one of our clinical nutrition classes. So they work independently of one another. So you need them all because they're all doing something very essential in the body. But during this time, in addition to a multivitamin, you want to do things that's going to boost the immune system function, right? You want to stimulate the immune system. What vitamins can we use for that? Okay, vitamin C. That comes highly recommended, okay? And I mean a loading dose. This is what we call loading doses, where you have a gram of it minimally. That's 1,000 milligrams. Okay. One of the things that I used to recommend to friends, family, even patients that came up to the pharmacy counter and they felt like they were coming down with something, and I would recommend a vitamin C regimen, which is very high dose. 3 grams at the start of your day, 2 grams at the end of your day, and total that will be about 5 grams. So that's the equivalent to 5,000 milligrams, but it's broken off in different parts of the day. And the reason that the highest part is at the beginning of the day is because it's the beginning of your day. You're going to need the most energy during that time where you're up, you're out, you're active, you're working. That's the reason you're taking a higher dose of the vitamin C at the start of your day, and then when you rest, because healing does take place with sleeping. Okay, so you want to make sure you have that, something that's going to be an immunostimulant while you're sleeping as well. So that is the method behind the madness when recommending such a high dose of vitamin C. For those of you who's wondering, is that too much? Am I going to overdose on vitamin C? No. Vitamins, they come in these other categories where we classify them as fat soluble or water soluble. Vitamin C falls into the water soluble category. So whatever the body does not use, it's going to excrete through your urine. Okay, so you're okay there. Try not to worry when it comes to the water soluble vitamins. The only thing that I would say when it comes to the fat soluble vitamins is it is proportion to your fat composition, like yours for yourself. So there is some caution when taking those. And the fat soluble vitamin that we're going to speak of next is vitamin D. D3 for the active form of vitamin D. There's a lot of supplements and things out there that has D2, and you don't want that. You want D3. We live in the northern regions of the country. We don't have a lot of sunlight. We're in the winter season now. It may be cloudy out there now. So from the sun and all of the processes to which the vitamin D is activated through our skin, we can't take advantage of that if we're in a winter climate. So if you get a supplement that's already an active form of the vitamin D, it's going to do a lot for you. Right now, I would say nothing less than 5,000 international units per day. And this is a loading type of dose. They have it where it could be the 50,000 international units of vitamin D. And those are the ones that are prescribed where you take once weekly. So that is perfectly fine to do during this time. And for the heavily melanated folks, we're kind of deficient in vitamin D anyway. So you want to take a little bit more and even in, when I start to think of some of the other specialties, you know, that I dedicated a lot of my research with in nephropathy, when it came to family planning, prenatal care, that sort of thing, vitamin D was one of those things that popped up a lot there. So that's just a little side note. So let's wrap this up when it comes to your supplementation. Multivitamin number 1, A to zinc, take one, okay? Vitamin C, loading doses, minimally 1 gram as a dose, okay? So even if that means you got to get 2 500s and you put them 500 milligrams and you put them together for a dose, that is a loading dose for vitamin C. Why aren't we concerned with loading doses of vitamin C? It's water soluble vitamin. Whatever the body does not use, it will excrete. You will not OD on the water soluble vitamin, okay? For our fat soluble vitamin that we're speaking of today, vitamin D, 5,000 international units daily. And if you have access to the higher doses where you could take it just on a weekly basis, that will be fine too. Again, we're in the winter months. We don't have a lot of sun, so that's not activating vitamin D from my skin to go in, work and do all of what it do inside chemically to help do all the things that vitamin do. And it's extensive what vitamin D does. But when it comes to the immune system, that's what I'm talking about. Vitamin A is another they call it the anti-infective vitamin as well. So that's the reason why I keep saying multivitamin, because you're going to get all of those vitamins, both fat soluble, water soluble, and you're going to get some of the other trace minerals inside of a multivitamin. That's why I keep coming back to that, because you can get everything. They work interdependently of one another. You need them all. Do not pick one and say, oh, I'm low on this B. I'm going to just take this B, but there's 25 other vitamins that you still need. So that's the reason why I can't emphasize this enough. Multivitamin. Get all of them. Put them in your body. Increase your immunity, your immune system. And during this time of this pandemic, we're under a lot of stress. We're overworked. We're sleep deprived. That's why you're doing the loading doses of those 2 vitamins that I was just talking about, C and D. Okay? So minimally 5,000 international units of vitamin D daily. And then the 1,000 milligram or 1 gram of the vitamin C as minimal as a dose. I have a little, what I want to call it, a recommendation for people that I would give. And that is the 3 grams of vitamin C in the morning, 2 grams at night before bed. So, so that's where I'm going to wrap that up as far as with the vitamins. There are other ways to boost your immunity. Okay, so we can talk about some herbal supplements. Okay, top of the list, elderberry. Okay, astragalus, echinacea. Those are just a few that come to mind. I'm not going to list a whole lot right now, but I do want to be able to give you some options. Okay, I do know that those other things that I recommended work. Because I've been suggesting it for many, many years, and we're talking over 15 years, and everybody's always come back with a positive report. Okay, so now I see some questions going on in there. Questions, inbox them. I'll be sure to answer them. The next thing, what we want to do, be a little more calming during this pandemic. Next question. Hand sanitizer or soap? Medically speaking, scientifically speaking, personally speaking, soap wins that fight every time. Soap. We have all these posts floating around social media. People get all crazy. The hand sanitizers are out of stock everywhere you go, but the soap aisle is full. Really? Okay. So let's talk about this, all right? We got to have the conversation. We have to have the conversation, okay? Because I remember specifically in pharmacy school, when we were taking microbiology and infectious disease, when we were talking about that, hygiene played a key role. And I'm going to say poor hygiene played a key role in the transmission and spreading of infection, okay? How clean somebody was. So I know everybody is like, oh, hand washing, you're kind of brushing over it. You're desensitized to it. But hygiene is key with that. And if we're going to choose between hand sanitizer and soap and water, soap and water should always win that fight. Now, there are going to be cases where you don't have access to running water and soap, and that is when the hand sanitizer will be suffice, okay? You want to be able to do something to protect yourself, right? Now, you want to make sure that these hand sanitizers are alcohol-based, okay? That means it's going to require you to turn it around and look to make sure that you see some type of alcohol in it. Now, the Centers of Disease Control, they have reports and statistics saying that as long as the alcohol-based sanitizer is minimally 60%, that's fine. Now, in my learning in pharmacy school, they always started at 70, or they just jumped to 70. And even though we have 70% out there, 91% you may see, you're not going to get any more benefit in jumping to the 91% alcohol versus the 70% alcohol. And that's not to say that you shouldn't buy it. It's just to say you're not going to get any more than what you're thinking because the numbers are higher. Okay, so if you don't have access to running water and soap, hand sanitizers will be sufficient. Okay, just don't overdo it. If your hands are visibly dirty, you see dirt on your hands or grease or some of the film on your hand, the hand sanitizer still isn't going to be as effective. And even in the cases where you can't see dirt or grease or whatever on your hands, it still doesn't cover all of the pathogens. It's not going to eradicate it. It's not going to get it off of you. Not in the ways of you using soap and water that may have antibacterial, antifungal, antiviral action. So let's just keep that in mind when it comes to the hand sanitizers, because we're on the go, we're always moving, and we want to be able to protect ourselves. So I am not saying this to say just forget about hand sanitizers. They have their place. But if you're going to choose one over the other, go to soap. Always soap and water. Okay. One more thing. With the alcohol-based hand sanitizers, alcohol is extremely drying to the skin. We're in the winter up here. Moisturizer. Okay. No cracked hands. No cracked lips. Feet, whatever your skin is the largest organ on your body. It is a protective organ, a protective barrier. And if it's cracked and open, now you're opened up to the outside world where all of these pathogens, bacteria, viruses, all of these things live, can now get into the inside of your body. So do what you can to make sure that you moisturize, okay? A part of moisturizing is hydration, water, okay? You don't start to see signs of dry skin, cracked skin, even thirst. You're probably already up to 16% dehydrated by the time you feel thirsty. Okay, so you can help yourself by staying hydrated. Okay, so hydration. That is going to help you tremendously with this. Okay, we're made up of water. Majority water is the only thing that is natural to the human body. Okay, and you certainly want to make sure that your cells, everything, you're adequately hydrated. We like to say, daily water intake, half your body's weight in fluid ounces. And that is to ensure that you are getting the proper amount of water for all of your tissues. Because once you drink water, your brain is going to hold the majority of it, okay? Your cerebral spinal fluid sits in it, and your brain, that's the computer, right? So it's going to hold a lot of that water, and it's going to ration it out to the other organs. So you can have organs that are severely dehydrated, and that's going to show signs and symptoms of a lot of dysfunction taking place. So when you don't have enough water, you can start to see some things happening in your body. And because as naturopaths, you're focused on that central nervous system, how it innervates, how it goes out and does what it do, how the micronutrients and macronutrients, how that ties into all of those chemical processes. That's pretty much what this is about, because everything is connected, okay? You can't have one without the other, okay? So that's the mind frame that we are, especially as naturopaths, as connective tissue specialists. You have connective tissue throughout your entire body. And so that's how that's your approach when it comes to supplementing your nutrition when we may live in food deserts, okay? That multivitamin daily, okay? I recommend probiotics and digestive enzymes to people or patients. I recommend that highly. Getting the digestion up to par is essential. Why? How do you think you're absorbing all of these things? Through your GI tract. So if that's not up to par, you could take all this stuff and you might not even get into the cells. So we want to do a lot of cleansing there, make sure that we have functioning digestive tracts so that we can get maximum absorption of all of these nutrients that we need to carry out the various functions of our bodies, especially the system we're needing most right now, our immune systems, okay? So I just wanted to talk about that a little bit, give some perspective so people can approach this in a more calm manner. This isn't the apocalypse, okay? We want to remember who are our at-risk populations, higher at risk. the elderly population, people who have decreased immunity, compromised immune systems, people with cardiovascular disease and diabetes, people with respiratory issues like COPD, emphysema, including asthma, okay? Those are the people, when it comes to come into contact with the coronavirus, they have a bit more of an uphill fight than the rest of us, okay? So we don't want to restrict any of their access to health care because we're overreacting, their access to the things that they need for survival. And this is, a community effort to make sure that we are thinking about more than just ourselves, that we're thinking about others too. So we want to relax during this time because this is not the first health pandemic. It probably won't be the last. Again, I've named 8 of the other health pandemics from 2004 with SARS all the way down to 2020 with the coronavirus. We had Ebola twice, Zika, MERS, swine flu. This has happened. So let's protect ourselves by getting the adequate nutrition that we need. And that's another thing. I went to the grocery store, meat section empty, produce section big, beautiful, bright, and colorful. Mind-boggling. You need raw foods that are living, that provide enzymes, that provide nutrients so that you can continue to live, have a better quality of life. But if you eat something dead, chances are it's not going to do a whole lot for you. Okay, so we want to keep that in mind too. While we're trying to boost our immunity, we want to get the right stuff in our body, foods that are going to help us and not hurt us, especially pro-inflammatory foods like dairy, that's going to just kick up your inflammation and mucus in the body. You don't want to have to battle the food. Your immune system is doing a lot, and we take it for granted, and we're not really good to our immune systems with the food and all the other junk that we eat, the processed foods, canned foods. And I get why we're buying it. Of course, everything in moderation. But again, let's make sure that we're trying to take care of ourselves, take in what we really need to take in, stay hydrated. Hand sanitizer versus soap. Soap always wins. Not in an area where you can get soap and water? All right, keep the hand sanitizer in the bag. That's fine. Alcohol-based sanitizer. Minimally 70% alcohol. Okay? Moisturizers. Let's not forget how drying alcohol is. Protect your skin. Protect yourselves. Protect your family. Again, this will pass just like all of the others. We're certainly enacting social distancing so that we don't have to spread this any more than we need to. And we don't want to forget about the other viruses that are around. Yes, we have a narrow focus on the coronavirus because that's the buzz, it has the most buzz right now. But there's still people in hospitals who have pneumonia and can't breathe, got fluid on their lungs. There are still people in hospitals that have the regular flu, influenza, and they're still having the same symptomology as people with the coronavirus. So although I don't want to, diminish the importance of being cautious and mindful of the coronavirus, I just want to bring the other ones and give them a platform as well. That while we're thinking about coronavirus, let's also think of pneumonia. Let's also think of influenza. Okay? And what should you expect? Because it's not a question, a lot of times it's not a question of if, but just when you come into contact, right? So what should you expect? You'll probably expect flu-like symptoms. Okay, and the ones that are on the top of that list of flu-like symptoms that we really want to pay attention to: fever, chills, a sore throat, body aches. Okay, those headaches. Those are things associated with flu-like symptoms, and it doesn't have to be the coronavirus that you have to experience those symptoms. The common cold, again, that's part of the rhinovirus family. Okay, so you can still contract any of those. So while we're walking around with our face mask, and I'm certainly not making any jokes about that, but it's not just corona, okay? Some of the other symptoms of the common cold versus the flu that you can experience. You can experience runny nose, stuffy nose, coughing, sneezing, okay? Those are natural, innate is the word I was looking for, immune responses, right, to anything that's foreign in the body. You ever spray any air spray or air freshener and a little of it kind of goes down and you cough? You don't have to think about coughing. You just cough on your own because that's a natural immune response. Your immune system kicks in. Hey, that's not supposed to be there. It's going to kick in, okay? And so you cough, all right? So we're going to have people out here in the world coughing and sneezing, and those are allergy symptoms. So that does not mean that they have this virus or that they should be we're going to treat each other as if we're going to make the assumption that we all do, just for protective measures for ourselves, because we still have other family members that could fall into those categories of the people who are at risk. So certainly we want to be mindful of that, but let's not quarantine everybody or look at everybody funny because they were sneezing, okay, because they may have allergies, okay? And again, like I said, that's just a normal immune system response to cough, to sneeze, runny nose. Now, when you get into the runny nose and stuffiness and all, that's more of a secondary immune response when the first response isn't as effective. So that's where inflammation comes into that conversation. And so we have our good inflammation, which is the immune response, and we have bad inflammation, chronic inflammation that wreaks havoc, okay? We won't talk about the bad inflammation right now because we're just talking about the immune system and how we can do our part in boosting our own immunity. So when you experience any of those things, we're quick to run out and buy those antihistamines and those decongestants, Claritin D, Allegra D. We're running out there to buy those things to stop the immune response. And that's because it's uncomfortable to us. But really, it is a protective barrier. It's there for our protection. And it is happening because there is something foreign inside of our body. And this is called, more systemic inflammation. And that can even be extrapolated to food. Okay, you're eating something that is causing an immune response. That should be how you eat something and you notice your nose start running, you're sneezing, you're stuffy, even not if it's immediate, even if it's a day later. Think about what was that last thing you ate and exit off your list. You don't need it unless you just want to run out and buy decongestants for the rest of your life, okay? And so I was going to also add with children, when you think about all of those symptoms too, I have a little one too, so with children, they may experience some vomiting and diarrhea in addition to the fever, the chills, the body. That's another thing to kind of pay attention to when it comes to the children and their symptomology if they come across something that is viral. Okay, so this is not just isolated to coronavirus, viral in general. Okay, viruses aren't going anywhere. They live amongst us, with us, probably been here before civilization. And so what we need to do is be able to live amongst this and be able to just protect ourselves. The last thing that I was going to say was just to recap on the vitamins that were suggested. A regular multivitamin, A to zinc, all right? Loading doses of vitamin C and vitamin D. You can scroll back in the video. I go over that in great detail of what those ratios are. Definitely the social distancing, okay? And hygiene. Cleanliness, okay? That can reduce the spread of this, okay? Hand sanitizer over soap. Soap wins that fight every time. No soap available? Hand sanitizer will be fine, okay? Because even it doesn't eliminate every bacteria or everything that could be on the surface. And you can actually go to the CDC website, the Centers of Disease Control, and it lists which pathogens. For those of you who care too, I know a lot of you probably don't care about the names of those bacteria or viruses, but for those who may, you can go there because that's pretty much, I'm stalking the Centers of Disease Control, the National Institute of Health, the World Health Organization. I'm stalking them right now to make sure that we stay current on everything that is happening. I don't like Fox News as a resource. So, again, those are just things that you can do. Oh, while we're all quarantined and at home and things, viruses. There's some other ones out there too that can be contracted, infections sexually. So let's be safe there too. We don't want, like, look, the immune system, it already got a lot of work to do, and we got to help it. So let's also be responsible there too. And I guess this is it. It's probably already got pretty lengthy. I don't even mean for it to go that long. So certainly be safe out there. Be well. Check on your elderly, your family. FaceTime them, Skype them, video messenger them or something right now. We just want to reduce the spread, and then we want to amp up our own immune systems so that we can get through this, and we will. All right? Be well, be safe, be encouraged.